Hi, Dr. Peter Osborne here. I'm the founder of Gluten-Free Society and the clinical director of Town Center Wellness. I'm one of the world's leading experts in functional medicine, and today I want to talk to you about a very important health concept known as the Triangle of Health. The Triangle of Health starts at its core, and at the core is the DNA. And many people have been told that we're doomed to disease if our parents had disease. So, for example, if your mom and dad have diabetes or heart disease, that you're basically preloaded to have those same conditions, and nothing could be actually further from the truth. DNA is not good or bad. DNA behaves based on the way we treat it. Let me give you an acute example. If you go underwater and try to breathe, you're obviously going to drown. And that's an example of misbehaving or treating your DNA in a bad way. Obviously, you don't have gills, so you're not going to extrapolate oxygen from water. So going underwater and trying to breathe is putting the DNA in an environment that it cannot possibly survive. And most illnesses are not so obvious and not so acute as going underwater and trying to breathe. Most of our chronic illnesses, heart disease and cancer and diabetes and osteoporosis, are influenced by choices that we make on a daily basis. And those choices build over time, either in a good or a bad way. So if we're making a lot of bad choices over a 10 or 15 or 20 year period of time, those bad choices perpetually influence the DNA. And what ends up happening is the DNA, in essence, is frowning. That's what disease is. It's when we put our DNA in an environment that's not conducive to its nature. So, there are three sides to this triangle of health, and these three sides represent the different environmental influences that we have control over, that we can choose, right, that influence our DNA in either a good or a bad way. Because at the end of the day, what we'd ideally like is we don't want our DNA to be sick, we want our DNA to be happy. And that's what health is when our DNA is being bathed in an environment that's conducive to good health. So, that's different for different people. Let's talk about the environmental influences that affect our DNA in a good or a bad way. The first is the mental component. Now, mental is mindset, right? It's optimism, pessimism, it's mind over matter. Mental has a lot to do with the environment that you put yourself in. If you've ever heard your parents say you are who you hang out with, that's a very true mental statement. If you put yourself and surround yourself with negative energy, with negative people, with a boss that is always yelling at you, or in a job that you can't stand or that you don't like, those are examples of putting yourself in a mental environment that's not going to be conducive to your good health. Somebody who's in an abusive relationship, somebody who lacks spirituality or doesn't know how to connect with that mental component. Those are areas, those are issues that we have a large degree of control over. We get to choose what we do for a living. We get to choose who we want to hang out with. We get to pick our partners in life. So all those play a role in mental health, and mental health, of course, influences DNA. Again, good or bad, either way. And so we want to be cognizant that we have choices to make here. You can wake up today and choose to have a good day. You can wake up today and choose to have a bad day. And that mind over matter is very, very important because it influences our DNA. Physical has to do, there's an old saying in medicine, square tires don't roll. And what that means and what that has to do with is structure or shape dictates function. In essence, the shape of something will dictate how it works. So I'm going to give you a couple examples of how physical components can impact the DNA in a good or bad way. The first example is somebody who doesn't exercise and gains a bunch of weight, right? So it's not that not exercising today or tomorrow is going to lead to a bunch of weight gain, but if we make the conscientious choice, because these are choices, to not exercise, to not take care of our human frame, then what ends up happening is over years we can end up gaining weight. Now that excessive weight gain can lead to excessive pressure on the heart, can lead to excessive pressure on the joints, right? And so the physical problem, which is excessive weight, can create, again, joint pain, joint arthritis, can put us in a state where our heart has to work harder to get just as much oxygen, just as much nutrient delivery to our tissues. And so by making the choice not to exercise, we're actually making the choice to affect our DNA in a negative way through physical means. Another example here would be scoliosis. Oftentimes, patients with scoliotic curves, big S-shaped curves in their spine, that causes compression of nerves, it can cause compression of lung fields, and so it can start to affect the way the human body is supposed to work. So that's a more obvious example of physical. Less obvious is gaining weight, and primarily because weight gain doesn't occur overnight. It occurs over a number of years of bad choices. And if you think about it, the term chronic degenerative disease, heart disease, cancer, diabetes, osteoporosis, They're chronic degenerative because a person starts to deteriorate and degenerate over time. So the more bad choices we make, again, over time, the more we influence DNA in such a way that it's going to frown down on us. The third side of this equation, and the side that doctors should be very, very focused in on, doctors who run lab tests and doctors who are trying to discern the origins of disease in patients, should be very, very honed in on biochemistry. Now, biochemistry or chemistry can be summarized in two basic ways. And those two ways are simply this. One, foods, or rather environmental influences that we ingest, whether through breathing or through water or through food, that affect us in either one, a good way, or two, a bad way. So examples here would be, obviously, sugar is detrimental. So ingesting excessive quantities of sugar, really any sugar at all, is going to lead to biochemistry influence over the DNA that promotes cancer, that promotes diabetes, that promotes bone loss, that promotes heart disease, right? So that's one example of how a food or food-like substance can contribute to abnormal biochemistry. So you could have poor food choices, meaning eating too much sugar, drinking too many things like sodas, and eating too much candy, or eating too many things that are high in the types of fats that are not conducive to good health, because obviously not all fat is bad for us. But man-made fat, hydrogenated fat, eating foods that are rich in that type of fat will have an influence over our biochemistry that is counterproductive to human health. So we can have food that affects chemistry, and then we can go even deeper and we can say, well, the food is supposed to supply vitamins and minerals. And so if we look at it very simply, we've got food that affects chemistry, and food is broken down into nutrients, and those nutrients are vitamins and minerals. And vitamins and minerals are the building blocks to biochemistry. As a matter of fact, every chemical reaction in your body requires a large sum of different types of vitamins and minerals for those chemical reactions to be able to even work. So if our food is not providing adequate quantities of vitamins and minerals, then we have an influence over our DNA that has an outcome that is poor health. For example, not eating enough foods that contain magnesium and calcium will lead to a chemical reaction that causes your blood vessels to constrict more frequently, and that restricts the flow of blood, and that subsequently will increase your blood pressure, increase the heart rate. And so now, through chemical deficiency, through vitamin mineral deficiency, we've actually induced a form of heart disease by affecting the way the DNA behaves. So again, it's the choice. It's choosing foods that are low in calcium, choosing foods that are low in magnesium, choosing foods that are high in sugar, high in hydrogenated fats, that would influence the chemistry in such a way that creates disease. Now, sometimes we say food is good for us in general, but sometimes there are foods that can be bad for us that are not quite as obvious as sugar and hydrogenated fat. And so that would be, an example of that would be something that we are allergic to, or something that we are intolerant to. Now, there's a difference between allergic and intolerant, and those basic differences are: an allergy is when we eat a food that our immune system doesn't like, and so we have an immune system reaction to that food. An intolerance is when we eat a food that we can't digest very well, and so the inability to digest that food leads to waste products that are forming in the intestines that now affect the health of the intestines, and so can create all other types of problems as a result. An example here would be lactose intolerance. An individual can't digest properly the sugar found in milk, and so the bacteria within the intestines start to ferment that sugar, and that can create alcohol. And of course, alcohol is not good for us, and so if we're intolerant to dairy and we're eating dairy on a regular basis, we're constantly producing alcohol. We're constantly producing waste products as a result of bacterial fermentation of that lactose, and that's going to influence the chemistry and the DNA in a way that's negative, or in a way that promotes disease. So you've got food allergies and food intolerance, and this is unique to an individual. So we might have an individual with, for example, a gluten intolerance or a gluten sensitivity, and so if that individual is following the status advice that most people get, which is eat plenty of whole grains, then that individual is going to end up being sick. If a person has a peanut allergy, obviously you're not going to want them to eat peanuts, because that's going to create an anaphylactic biochemistry reaction that leads to an acute situation that could potentially kill a person. So we've got food as being, the breakdown is vitamins and minerals, and we've also got foods being one man's food is not necessarily good for another man. So we've got, one man, what's poison for one man may be healthy for another. And so this is very, very individualistic. And so doctors that are treating patients and trying to discern the cause and the origin of disease or dysfunction should be looking at food first, and they should be ruling in and out food allergies, vitamin and mineral deficiencies as a core to investigate biochemistry. Now, one other element of biochemistry that oftentimes does get talked about is infection. And so you can have, for example, we said chemistry is defined as two things that come into the body that hurt the body, things that come in that can help the body. So food obviously can be a helper or a hurter, vitamins and minerals helpers, but infection is something that can come in the body and create damage and create problems. So you've got bacterial infection, you've got viral infection, you can have parasitic infection, yeast infection. These are all just different elements that can have an impact, again, over the chemistry that can influence the behavior of the DNA. So that's chemistry in a nutshell. So we've got physical, biochemical, and we've got mental. All three influence the DNA either in a good or a bad way. But the other component here is that they all three influence each other. So, for example, physical, if you don't exercise, you can become depressed because you're not making endorphins and enkephalins. That depression leads to what? An inability to want to exercise. So generally a depressed person doesn't feel like exercising, and a person who doesn't exercise gets depressed, right? And depression is actually a chemical abnormality of an absence of certain types of nerve chemicals or neurotransmitters. So you can see each side affects the other. Chemically speaking, we got a magnesium deficiency. Magnesium is a mineral, right? And a magnesium deficiency can cause a physical muscular tightening. It can lead to muscle cramps and muscle spasms. Magnesium deficiency can make your blood thicker, and so it's harder for your heart to pump your blood. And that leads to less oxygen to your muscles, so now your muscles can start to deteriorate and atrophy. Now we have deteriorated, atrophied muscles, and it hurts to exercise, so we don't, and so we become mentally depressed. And so I say this just as examples so that you get a general idea that each side affects the other side. Each side influences the DNA, and ultimately the outcome of the DNA is what we're after. We're after that happy outcome. So if you have in medicine, which is what you have in medicine primarily, is you have doctors who focus on artificial manipulation of chemistry. And so what we're saying here is that you go see a doctor, you generally have some type of health complaint. Doctor runs a few tests, says you have X, Y, or Z disease, right? And so in this example, let's just say doctor runs some tests, your cholesterol is high, says you have high cholesterol, you're at an increased risk for heart disease. So what does he do? Instead of trying to decide where the high cholesterol is coming from, he prescribes an artificial medication or a synthetic drug whose job it is to artificially manipulate your chemistry to bring your cholesterol levels down to normal without discerning why the cholesterol levels are high in the first place. And so that can be very, very problematic in trying to recover and in trying to restore health or in trying to be healthy in general, because every drug, no matter how we artificially manipulate chemistry, every drug has what we call a risk-benefit ratio. And that risk-benefit ratio is the benefit of the drug worth the risk of the side effects that the drug induces? And so in the case of cholesterol medications block vitamin D, block coenzyme Q10, and so deficiency of those two nutrients can actually cause heart disease. I know it sounds kind of ironic that we would use a chemical to lower the risk for heart disease that ends up inducing vitamin deficiencies that can actually contribute to heart disease. But that's the crazy world that we live in. So artificial manipulation of chemistry absolutely never works unless we're talking about something acute like an infection. If you have a bacterial infection and require an antibiotic for treatment, then using an antibiotic would be a good example of where artificially manipulating chemistry on a temporary basis would lead to a positive outcome that would allow a person to basically restore their health. But using an artificial chemical or an artificial drug to manipulate chemistry for a lifetime, in essence, most of the time when a person goes in to see the doctor, they're told you have X, Y, or Z problem, you have to take this drug for the rest of your life. That's not a solution. That's a covering of symptoms without discerning the origin of disease. So I hope you learned a little bit about what you want to look for in a physician and what you want to look for in terms of trying to regulate and dictate your own health and take control of your own health. And so understanding this diagram, understanding the triangle of health, understanding how your choices in the environment influence your DNA, And so your outcome can be healthy or your outcome can be sick, and now you're empowered to be able to make choices.